Hello, I'm Dr. Jimmy Douglas, and let's understand a few terms which we'll be using today in reference to Gastro Esophageal Reflux Disease or GERD. Heartburn. It's a feeling of burning sensation in the chest, behind the sternum or the breastbone, often radiating to the neck. And acid reflux is acid produced in the stomach is flowing back into the esophagus. It's reflux. R-E-F-L-U-X, meaning flowing back. GERD or Gastro Esophageal Reflux Disease is a condition which develops when reflux of the stomach contents flows into the esophagus, causing troublesome symptoms and may lead to complications. The characteristic symptoms of GERD are heartburn and regurgitation of sour material in the mouth. Regurgitation is when the reflux reaches the mouth. It may happen after meals or during night time, or it may even awaken you from sleep. Other symptoms commonly seen are dyspepsia. Dyspepsia is a recurrent pain or discomfort in the center of the upper abdomen, and it is present in 1/3 of the patients in GERD. Dysphagia is difficulty in swallowing, and belching is also called as burping. There is chest pain, cough, and hoarseness. Hoarseness is due to irritation in the back of the throat due to the acid reflux. It is also called as reflux laryngitis. The patient tend to keep on clearing the throat. First and foremost, it's very important to rule out cardiac causes of your symptoms with your doctor. Population studies have shown that 15% of the populations have heartburn at least once in a week, and 7% of the population have heartburn every day. And the condition in majority of these patients is mild. Most commonly, the patients have mild disease, and when the acid from the stomach reaches the esophagus, it causes mucosal damage. And around 1/3 of patients develop mucosal damage, and it's also called as reflux esophagitis. And if the reflux is severe, it may reach the pharynx in the mouth and cause laryngitis, morning hoarseness, and breathing difficulties if it enters the lungs. Now let's look at the causes as to why this backflow of acid from the stomach is happening. When we swallow food, the food enters the food pipe and into the stomach, and before entering into the stomach, the lower esophageal sphincter relaxes. In GERD, lower esophageal sphincter relaxes in absence of swallowing, or it may happen due to loss of muscle tone in the lower esophageal sphincter, which acts as an internal sphincter, or incompetence of the diaphragmatic crural muscle, which acts as an external sphincter. The stomach contents are most likely to reflux when the stomach volume increases, that is, after having large meals, or when the food is near the gastroesophageal junction, and when bending down, or when in a lying down position. And it may happen when the gastric pressure increases. It happens when the person is obese in pregnancy, and it might happen when the person is wearing tight clothes as well. And it might happen due to consumption of certain medications and food like citrus fruit or fatty food or fried foods. Investigations. Diagnostic studies are not required in majority of the patients with typical GERD symptoms. Most of the patients are treated with proton pump inhibitors or drugs which inhibit the secretion of acid from the stomach for 4 to 8 weeks, and the majority of the patients show improvement of the symptoms. If the patient is showing alarming features like troublesome dysphagia, that is difficulty in swallowing, and when this is persistent, then we'll be thinking of peptic stricture or abnormal narrowing of passages as the probable diagnosis, and this usually happens after years of heartburn. Odynophagia, that is pain while swallowing, and if the patient is losing weight, if there is iron deficiency anemia, all these warrant upper endoscopy to determine the type and extent of mucosal injury and to find out the conditions which may be GERD or its complications. Other investigations are esophageal pH monitoring, which is done to know the amount of acid reflux, while combined esophageal 24-hour pH impedance test. It measures both the acidic reflux and the non-acidic reflux, and it is to find the correlation between the reflux and the symptoms, that is, whether the symptoms are occurring due to reflux. The test involves placing the tip of the catheter in the lower esophagus by passing it through the nasal opening. The other end of the catheter is the data recorder machine. You will be able to swallow, talk, and breathe during the test procedure, which is of 24 hours. And these tests are not required in majority of the patients, but they are indicated when persons with typical GERD symptoms not responding to medications, atypical or extraesophageal symptoms, meaning cough, asthma, laryngitis, or when the patient is being considered for reflux surgery. In the next video, watch the medications used to treat GERD and what are the foods to eat and what to avoid. Thank you for watching, and see you in the next video.